हेलो स्टूडेंट्स, आज हम शुरू करेंगे FMT PYQ AIIMS 2017। NICT 2020 से शुरू हुआ था, तो हम प्रीवियस ईयर्स में इस 2017 से ही शुरू करेंगे। फर्स्ट क्वेश्चन है, A 35-year-old male came to the OPD with complaints of an increase in his heart rate and palpitations. On examination, there was episodic tachycardia and occasional excess stool. Ocular examination showed visual field defects. Which of the following is likely cause? A. Cocaine, B. Nicotine, C. Cannabis, D. Atropine. का करेक्ट आंसर है बी, निकोटीन। एंड एक्सप्लेनेशन है ये, द गिवन क्लिनिकल सिनेरियो इज सजेस्टिव ऑफ निकोटीन पॉइजनिंग। Chronic poisoning of nicotine, also known as nicotine addiction, leads to a condition called tobacco heart. It is characterized by irregularities of the heart with occasional excess stool and angina. It also causes amblyopia and narrowing of the field of the vision. Second question, which of the following is true regarding corporobasal index of the sacrum? A. Breadth of the fifth lumbar vertebra into 100 by breadth of all sacral vertebra. B. Breadth of first sacral vertebra into 100 by breadth of fifth lumbar vertebra. C. Breadth of fifth lumbar vertebra into 100 by breadth of base of sacrum. C. Breadth of first sacral vertebra into 100 by breadth of base of sacrum. इसका आंसर है डी, breadth of first sacral vertebra into 100 by breadth of base of sacrum. का correct explanation है ये. Corporobasal index is given by the formula is equals to corporobasal index is equals to breadth of first sacral vertebra into 100 by breadth of the base of the sacrum. Corporobasal index of the sacrum is one of the indices used to determine the sex of individual. Next question आता है, a person was brought dead and an autopsy was performed to find the cause of death. The following findings were noted on examination. What is the probable cause of death? A. Throttling, B. Strangulation, C. Hanging, D. Mugging. इसका आंसर है A. Throttling. And explanation here. The given autopsy images are suggestive of throttling. Thumbnail impression over the neck. Petechial hemorrhages in the eye. This one petechial and this one is thumbnail impression, neck के आसपास. Extravasated blood clots surrounding larynx. In throttling, the following mechanism may lead to death: occlusion of blood supply to the brain carotid arteries, occlusion of the airway, minor role. Carotid sinus pressure may result in vagus nerve stimulation, resulting in cardiac arrest. Next question पे आते हैं. First carpal bone to ossify: lunate, capitate, hamate and scaphoid. इसका आंसर है capitate. Capitate is the first carpal bone and pisiform is the last carpal bone to ossify. एज ऑफ ऑसिफिकेशन सेंटर्स ऑफ कार्पल बोन्स, इसमें एज के अकॉर्डिंग दिया हुआ है कौन सा कब ऑसिफिकेशन. जैसे कैपिटेट 1.3 मंथ पे होता है, हेमेट 2 to 4, ट्राइक्वाड्रम 2 to 3 years, ल्यूनेट 2 to 4 years, स्कैफोइड 4 to 6 years, ट्रेपेजियम 4 to 6 years, ट्रेपेजॉइड 4 to 6 years, पिसिफॉर्म 8 to 12 years. The next question, a 14-year-old rape victim presents with 26th week of pregnancy. What should not be done? A. Female doctor should examine the patient. B. Vaginal swab examination is not necessary. C. No need to confirm pregnancy by UPT. D. Termination of pregnancy by her consent by a gynecologist. इसका आंसर है D. Termination of pregnancy with her consent by a gynecologist. According to the MTP Act 2021 amendments, pregnancy beyond 24 weeks of gestation cannot be terminated. Also, the guardian's written consent is required in the case of a minor girl. Up to 20 weeks of pregnancy, any qualified practitioner can perform an abortion, however, must have undergone compulsory training. Between 20 to 24 weeks of pregnancy, the opinion of a second practitioner must be obtained to justify performing the abortion. The woman to be wanting an abortion should be above 18 years of age to consent. If not, consent can be obtained from the parents or guardians when she is a minor or mentally unsound. Question number 6. In a case of a gunshot injury to skull with entry wound at left temporal region surrounded by a abrasion collar, tattooing and a exit wound at right temporal region along with metal fragments of bullet inside the bullet track, which of the following should be preserved to determine the range of firing? A. Hair, B. Bullet pieces, C. Blood, D. Clothes. इसका आंसर है A. Hair. The main objective of the study of a firearm wound ballistics is to establish the range and direction of the firing. The ultimate purpose is to determine the weapon used for firing. Firearm wounds are of two fundamental types: wounds of entry and wounds of exit. The wound of entry is the wound through which the bullet or pellets enter the body, and the wound of exit is the wound through which the bullet emerges out of the body. To determine the range of firing, the following parameters are used: entry wound, size and shape, blast effect, muzzle and imprint, and edge eversion, blackening, tattooing, singing of hair, abrasion color, and grease color. Question number 7. Order of appearance of rigor mortis: A. Orbicularis oculi, facial muscles, thorax, upper limb; B. Orbicularis oculi, neck, facial muscles, upper limb, thorax; C. Neck, muscles of eyelid, upper limb, thorax; D. Neck, muscles of eyelid, facial muscle, thorax, upper limb. इसका आंसर है A. Orbicularis oculi, facial muscle, thorax and upper limb. The correct order is orbicularis oculi, facial muscles, thorax and upper limb. Nystron's rules describe the sequential onset of rigor mortis in various muscle groups. Rigor mortis begins from the head and progresses down to the body. The order of appearance of rigor mortis is heart, left chamber, eyelid, muscle of the neck, lower jaw, muscles of the face, muscles of the chest, upper limb, abdomen, lower limb, fingers and toes, proximal to distal progression. Question number 8. Blackfoot is seen in which poisoning? A. Arsenic, B. Lead, C. Mercury, D. Phosphorus. इसका आंसर है A. Arsenic. Blackfoot is a disease is a form of arsenic-induced peripheral vascular disease resulting in gangrene. Arsenic is a heavy metal inorganic irritant poison. Metallic arsenic is not poisonous as it is insoluble in water and cannot be absorbed from the GI tract. However, arsenious oxide or arsenic trioxide is poisonous. Question number 9. Criminal responsibility of insane is defined in A. McNaughton's rule, B. Curran's rule, C. Durham's rule, D. American Law Institute test. इसका आंसर है A. McNaughton's rule. McNaughton's rule was formed by the judges of McNaughton's case to clarify the common law of insanity in England during 1843. It is similar to IPC 84 or BNS 22, which states nothing is an offense which is done by a person who at the time of doing it by reason of unsoundness of mind is incapable of knowing the nature of the act, or that he is doing what is either wrong or contrary to law. This forms the basis of the test of insanity that the jury should be instructed to apply in each case of alleged insanity. Question number 10. An autopsy was performed to find the cause of death of a person brought dead to the casualty, and it showed a fracture of thyroid cartilage and bruising around the neck. The cause of death is A. Hanging, B. Throttling, C. Strangulation, D. Mugging. इसका आंसर है B. Throttling. Both bruising around the neck and the fracture of the thyroid cartilage are findings seen in throttling. Throttling or manual strangulation is when bare hands are used to compress the neck and strangulate. Mechanism क्या होता है इसका? Occlusion of blood vessels supplying blood to the brain, carotid arteries. Occlusion to airway probably plays a minor role, if any, in causing death. Carotid sinus pressure may result in vagus nerve stimulation, resulting in cardiac arrest or vagal inhibition. Question number 11. A 30-year-old drowsy male was brought to the casualty. His pulse was 130 per minute, respiratory rate 30 per minute. His lab reports are given below, and he showed improvement on nasogastric aspiration and administration of sodium bicarbonate, calcium gluconate, and 4-methylpyrazole. What substance did he most likely consume? A. Formaldehyde, B. ethylene glycol, C. Paraldehyde, D. methyl alcohol. इसका आंसर है B. ethylene glycol. The given scenario points towards ethylene glycol poisoning. Ethylene glycol is converted to glyoxyaldehyde by alcohol dehydrogenase. Glyoxyaldehyde causes kidney damage. Methanol is converted to formaldehyde by alcohol dehydrogenase. Formaldehyde causes retinal damage like blurring of vision or loss of vision. The the principles of treatment for both these conditions are the same. It predominantly involves using fomepizole or ethanol to inhibit the metabolic conversion of these relative non-toxic alcohols to their toxic metabolites. Question number 12. Which of the following is false regarding teeth features and ethnicity? A. In Africanoids, the cusps of molar are wide and deep, and shovel-shaped cusps in incisors. B. Caucasians have carabali cusps. C. Upper third molar is most commonly absent in Mongolians. D. Prominent lingual ridge and labial ridge in Mongols. इसका आंसर है A. In Africanoids, the cusps of molars are wide and deep and shovel-shaped cusps in incisors. इसका correct explanation है ये. The cusps of molar are wide and deep and cusps of incisors are shovel-shaped in Mongoloid races. The Africanoid races tend to have large teeth and often have more cusps on their molars, even up to 8, with two lingual cusps on the mandibular first premolars as an additional common finding. In Caucasian races, the lateral incisor in the upper jaw are usually smaller than the central. They also have long pointed canine roots. Small nodules on the lingual surface of maxillary molars called carabalized cusp are most common in Caucasian races. In Mongoloid teeth, enamel pearls and small nodules of enamel on the tooth surface are much more frequent. The condition of bull tooth or taurodontism is most common in Mongoloid people. The pulp cavity of molars is wide and deep, and the roots are fused and bent. A congenital lack of the third upper molar is most commonly seen. The lingual and labial ridges are more prominent. Question number 13. Jackknife position causes death due to A. Wedging, B. Burking, C. Positional asphyxia, D. Traumatic asphyxia. इसका आंसर है C. Positional asphyxia. It is a position where the victim's thigh and knees are driven against the chest, causing indirect compression of the chest and restriction of breathing movement. Thank you so much, guys.